If you have been using some skincare ingredients, some products that have just been doing wonders for your skin, and you're wondering if you can continue to use them now that you're pregnant or you're trying to get pregnant, this video is for you. Hello everyone, I'm Dr. Adilopo Esther, yes, known as the Village Belle. I'm a medical doctor as well as a skincare enthusiast. I love to share tips on how to take care of your skin at every stage of your life and how to get the best out of your skincare products. So if that sounds like something that you love, I want you to like this video and subscribe. Remember that as you watch on, you need to share this video as well. So let's get right into it. So before we go on, I want to put out a disclaimer there. As with anything that you put on your skin and you take in by mouth, you need to always consult with your doctor, whether you're pregnant or not. And that includes all the things I'm going to be mentioning. Also, when it comes to pregnancy is just a peculiar period in our lives. And it's just a wonderful period where we're growing this beautiful baby. And we want to make sure that whatever we do does not mess things up. Now, the recommendations that come in this video are actually from retrospective studies. Don't worry, I'll explain. So meaning that we found out that, okay, after women have been pregnant, giving birth, and then we tried to go back and look for the things that they were using, skincare products. And, this research has shown what effects some of these things may have had on women previously, when they were pregnant. So obviously it's not ethical to actually test products on women that are pregnant just because we want to find out if it's going to harm their babies or not. So some of the recommendations are clear-cut that there is no harm. Some a bit controversial, meaning that yes, they may be in the blood, and so we're wondering, we don't have enough data to support whether to use them or not. And then there are some that are outright no-nos, meaning that from these studies and research, we have found out that these products actually cause harm to the fetus, whether these products or derivatives of this product. So let's start with the no-nos, the ingredients that you should definitely not use in your skincare. First are retinoids. So what are retinoids? Retinoids are products that have an anti-aging benefit. Those products that you apply that help with your fine lines, your wrinkles. They help to regenerate the skin, collagen build up in the skin, just make you look more youthful and younger. And I'm sure you've heard of a lot of those products. You tend to hear them as retinol serum, night repair serum, wrinkle repair, and you tend to hear names like that. Those are retinols. There are different types of retinoids. Retinol is an over-the-counter one, something that you buy and you just get easily out there, and they exist in many different products. You also have other retinoids like tretinoin. Tretinoin is something that is prescription. So that means that it's not just something you should just buy without the recommendation of your doctor. And it's very strong and it helps with wrinkles, with fine lines as well. Now, concerning retinoids, the number one ingredient that has been touted as being a no-no for pregnancy skincare is isotretinoin, which is the oral vitamin A, the oral form of retinoids. So isotretinoin, it has been found out to cause fetal anomalies. Fetal meaning that the baby is born with defects, body defects and things like that. So yes, on one hand, we found that research with isotretinoin, but all these other ones that I've mentioned, so the tretinoin, retinol, retinaldehyde, even up to adapalene, which is differin, it's a no-no. Don't even touch it at all, because like I said, nobody wants to be the guinea pig. We don't want to learn from somebody else's issue, so we say it's better you just stay off it. If we have found out that the major in the group, that isotretinoin, has been found out to cause anomalies in fetuses, we don't even want to try like its derivatives, the other ones that are in the same group with it. So we X all of them out. The next one is hydroquinone. Hydroquinone is an agent, is a depigmenting agent, meaning that it helps to brighten the skin, in fact, lighten the skin. It is a heavy duty pigment reducing agent. Yes, I know that most of us in this environment, I'm talking about Nigeria, we've heard of hydroquinone. In fact, we've experienced it, we've used it at one point in time, whether knowingly or unknowingly. It's out there all over in the market at different percentages. Guys, as in, I am begging you, please, when it comes to pregnancy, we take out hydroquinone completely. Do you know why? Because hydroquinone, we find out that up to about 30 to 35-40% is absorbed through the skin. So this is quite high. Do you understand? It's quite high. And we know that hydroquinone on its own, long-term usage and things like that, does have side effects normally, even in the adult skin. So not to talk of the baby as well. And if we're having that much being absorbed in the skin, we don't want to take chances. You understand? So that's why we say hydroquinone is a no-no. So there are some products that contain hydroquinone, and I want you to please stay clear of, these products, especially when you're pregnant. And even after pregnancy, please make sure you're using, if you ever have to use hydroquinone, you're using it under the supervision of a professional so that you do not expose yourself to side effects. Most doctors really, because we've seen so much of its side effects that it has almost become more concerned about the side effects it has on the skin from prolonged usage of unregulated amounts and percentages, exogenous uncronosis. And then we go on to Arbutin. Arbutin is a precursor of hydroquinone. What that means is that in the skin, when the skin absorbs Arbutin, eventually it is converted to hydroquinone. So because of this reason, we just take Arbutin out as well. Like I explained earlier, it's not about the product demonstrate outright fetal anomaly, no. But if by extension, we found out that its parent can demonstrate some abnormalities in the babies, we don't even want to go near it. So please, Arbutin is out. It can be found in Siam Vita B3 stores. It contains 2% in. So this is not a product you should use in pregnancy. Okay. Then there are drugs that we use in for acne treatment, for instance, tetracycline, spironolactone. And because we're now pregnant, some of these drugs are contraindicated in pregnancy. So if you are on any sort of medication, or if you are trying to get pregnant or you're pregnant, when you're having a consultation with your doctor, you want to discuss this with your doctor and say, okay, you want to treat me for acne, however, I'm pregnant or I'm trying to get pregnant. You want to have this conversation with your doctor so that the appropriate drugs can be prescribed and the ones that are not safe can be avoided. Next, we go on to procedures. There are some procedures that are a no-no in pregnancy. Why? Because in pregnancy, we can be exposed to, we're prone to irritation. The hormones are causing the skin to go haywire. Sometimes, even we are prone to having hyperpigmentation. That's like melasma. So one of the procedures that we advise you not to do during pregnancy is any heat, any procedure that exposes you to heat. An example would be going to the sauna or, facial steaming and things like that. Yes, I mean, everybody does eventually makes up their mind about what they want to do. But these are just general recommendations about how to take care of your skin and things that you want to avoid in pregnancy. So the reason why you don't want any heat exposure of any sort, in fact, undue sun exposure, like walking up and down, go to the market, shopping for baby stuff every day, like I'm talking to myself. I'm one of those people that was always going to go and check, like as if they were going to bring out the latest new thing and all that. But please, mamas, when you're pregnant, you don't want undue sun exposure. The reason why is because hyperpigmentation or darkening of the skin can happen in pregnancy. We call it melasma, the cloak of pregnancy, where you suddenly just realize that your face just gets darker than the rest of your body. These conditions are heat sensitive, meaning that if you expose yourself to heat, sunlight, it makes it more aggressive, basically. Also, procedures like Botox injections, we tend to avoid that also in pregnancy. You can wait until after you've had your baby and all that, especially if this Botox injection is purely for cosmetic reasons. We understand that sometimes Botox can be given for medical reasons such as migraines, but if your Botox is just to help, fine lines, make your face look glowy and all that stuff, please just avoid the Botox. We can wait. I understand the need, because pregnancy sometimes, everybody's just looking fly, but you are looking like somebody's house girl. Yes, I understand. But please, at the same time, it's temporary, okay? It's temporary. There are many other things, safer things that you can do to your skin. Instead of the Botox, you can even use peptide creams that can help to give you that boost, hyaluronic acid creams that can help give you that boost. So please, let's avoid the Botox, okay? Another thing, usually people who are suffering from hair loss are prescribed topical minoxidil. Minoxidil is a drug that had been used previously for hypertension, even though it's not that effective for it. So the topical, but people were found out to be hairy, after using minoxidil. So now minoxidil in its topical form, example Rogaine, is actually applied on the areas of hair loss, and people are prescribed this to help control their hair loss. Now, when you're pregnant, we say don't even use minoxidil. Minoxidil is not something that you want to use in pregnancy as well. So you need to stop that hair treatment. And another thing is that during pregnancy, your hair tends to retain your hair length. Your hair begins to grow even more when you're pregnant. So there isn't an urgent need to actually use minoxidil and risk the health of your baby at this time. Okay. Remember that skincare is deeply personal, meaning that you have to work with your physician, your doctor, your GP, your dermatologist, your gynecologist in making decisions about what is safe for you in your skincare. Because you know that whatever recommendations your doctor will give also is determined by whatever pre-existing conditions you had, or even if this doctor was treating you for acne before you got pregnant and has to make decisions. For instance, a product like isotretinoin, your doctor will usually have to even give you 2 birth control methods just to ensure you do not get pregnant while on it. Make sure you remember to share this video with someone else. It has been helpful to you, so share this video with someone else. And remember, if you've not subscribed, please click the subscribe button and watch some of my other videos that will be recommended. Really help your skin. Remember to keep your skincare simple, short, and sweet. I'll see you in my next video. Bye.